Hello nurses and future nurses.
Today, we're breaking down the autonomic nervous system, one of the most tested and clinically important topics for nursing exams and real-life patient care.
If you've ever given atropine, administered a beta blocker, or monitored a patient's heart rate after epinephrine, you are already working with the autonomic nervous system. By the end of this video, you'll clearly understand the two divisions, how they affect body organs, key neurotransmitters, and important NCLEX clinical connections. Let's simplify it step by step. What is the autonomic nervous system? The autonomic nervous system, or ANS, controls involuntary body functions. That means heart rate, blood pressure, digestion, pupil size, respiratory rate. All of this happens automatically, without conscious control. Its main goal: maintain homeostasis. Division 1. Sympathetic nervous system. Fight or flight. This system activates during stress, danger, trauma, or emergencies. Think: car accident, patient crashing, severe hypoglycemia, anxiety attack. The body prepares to survive. What happens physiologically? Heart rate increases, blood pressure increases, bronchi dilate, pupils dilate, blood glucose increases, digestion slows down. Why? Because blood is redirected to the heart, lungs, and muscles. Neurotransmitters in sympathetic system. Preganglionic neuron releases acetylcholine. Postganglionic neuron releases norepinephrine. Remember, sympathetic equals norepinephrine most of the time. Parasympathetic nervous system. Rest and digest. This system works when the body is calm and stable. Think: after eating, sleeping, relaxing. It conserves energy and promotes healing. What happens physiologically? Heart rate decreases. Blood pressure decreases. Pupils constrict. Bronchi constrict. Digestion increases. Salivation increases. This system supports nutrient absorption and recovery. Neurotransmitters in parasympathetic system. Preganglionic, acetylcholine. Postganglionic, acetylcholine. Parasympathetic equals all acetylcholine. Easy comparison for exams. Sympathetic, stress. Parasympathetic equals peace. Sympathetic speeds things up. Parasympathetic slows things down. They always work in balance. NCLEX and clinical connections. Now, let's connect this to medications and real nursing care. Atropine blocks parasympathetic activity. Result: heart rate increase,
Used for bradycardia. If a patient's heart rate is 38 bpm, atropine is ordered. Why? Because we block rest and digest signals. Beta blockers, metoprolol, propranolol, block sympathetic stimulation. Result: heart rate decreases, blood pressure decreases. Used for hypertension, tachycardia, post-MI patients. Epinephrine stimulates sympathetic system. Result: increased AJAR, bronchodilation, increased BP. Used in anaphylaxis, cardiac arrest. Important nursing concepts: cholinergic excess, too much parasympathetic. Symptoms: bradycardia, diarrhea, sweating, salivation. Think sludge. Salivation, lacrimation, urination, diarrhea, GI upset, emesis. Treatment: atropine, anticholinergic toxicity, too much sympathetic effect. Symptoms: dry mouth, dilated pupils, tachycardia, urinary retention, memory trick. Hot as a hair, dry as a bone, blind as a bat. Why this matters in real nursing. You will assess vital signs, pupil changes, GI function, medication responses. Every shift, you are observing autonomic balance. When a patient becomes tachycardic, hypotensive, or diaphoretic, think: which division is activated? Critical thinking begins here. Quick review before we end. Autonomic nervous system controls involuntary functions. 2 divisions: sympathetic, fight or flight; parasympathetic, rest and digest. Sympathetic uses norepinephrine mostly. Parasympathetic uses acetylcholine only. Medications either stimulate or block these systems. If this video helped you understand the autonomic nervous system more clearly, make sure to like, share, and subscribe to the channel for more simple NCLEX-focused nursing lessons. Learning complex topics doesn't have to be complicated. See you in the next nursing breakdown.